Hello, everyone. My name is Kara Canuck, and I am one of the co-owners of Des Moines Mom. And today we are doing another Mental Health Monday interview. And so I am happy to introduce Dr. Michelle Ewest. She is a pediatrician who works at the Blank Children's Developmental Center on West Elm Parkway in West Des Moines. Can you tell me a little bit about what you do there, Michelle?
Sure. So I'm a general pediatrician and I work at the Developmental Center, like you said, and I work primarily with kiddos with autism and do the diagnosis and evaluation and management of that in addition to ADHD.
All right. So I forgot to say that we are talking specifically about ADHD today. Dr. Ewest, can you tell me a little bit about, how if a mom or a teacher or family is suspicious that their child has ADHD, what do they need to do about getting it diagnosed?
Sure. So you can definitely start with your general pediatrician and talk with them and let them know kind of what you're seeing at home. So for a diagnosis of ADHD, you need to have impairments in at least two settings. So typically it's school and home, extracurricular activities, those kinds of things as well. There's parent scales that can be filled out, and your doctor can get you those. And so they would want to have information from school, what the teachers are seeing, in addition to home.
Okay. Okay, you said functional impairment, at least two settings. And then is there like a testing process or just like those questionnaires that you talked about, or, what happens there to get a diagnosis?
Sure. So the questionnaires are a part of the process, but you'll also want the doctor will take a look and see if there's other reasons that could be happening,
Mhm.
and if you meet criteria for a diagnosis of ADHD.
Okay, so I know sometimes, parents will say, "Oh, well, kids are always crazy at this age. It's just a phase. They'll grow out of it." But how do you know when it's not just a phase and when you think it
Yeah.
might be something bigger?
Yep. And so, you want to look at the kids. So if you have the kids' capabilities up here, and then you have where they're performing here. So there's a gap in there. So when you compare them to their peers in different settings, there's an obvious gap. And within that gap, there can be things like academic failure, poor self-esteem, difficulty with peer interactions. And so that's the functional impairment piece that you're looking at. So it's not just a phase or just having difficulty in certain situations. It's something that's happening in many areas of life.
Okay. So can ADHD get better with time? Can kids outgrow it? Is
Yeah,
there something that we can see with light at the end of the tunnel?
yes, for sure. Great question. So there's a lot of behavioral strategies that are first and foremost,
Mhm.
whether those are at home or at school. And along with those, typically a third of the children diagnosed with ADHD are never on medication. That behavioral strategies are enough for them. A
Mm.
third of them are on medication and they are on that while they finish school, and then they're not taking it when they're in as an adult. And then a third of them start when they're, a child, and they continue into adulthood. So there's definitely different paths.
Okay. All right. Well, I think that's how it's like anything. Each child, each person is different in their situation and maybe their behaviors like great. So you can't lump everybody into the same group.
Definitely.
What
Definitely.
are some behavior strategies as far as trying to help my child manage their ADHD?
Yeah. So home strategies, if you think about the most challenging times, they're typically in the morning, right?
Yeah.
Getting everybody out the door in the morning, or that time from after school to dinner time, or weekends, right? So it's typically the unstructured time or the time when you've got some things and you've got to get going and there's a schedule. So for instance, morning routines, it can be super helpful to have a visual schedule with a picture of everything that they have to get done. So, get up, get dressed, eat breakfast, brush your teeth. And so if they're not, let's say they're not brushing their teeth, they haven't done that. Instead of saying, you have to brush your teeth, you have to brush your teeth, and then it turns into this battle between you and your child, you can just say, check your schedule. And then they can go and look at the schedule. They can see, oh, I didn't brush my teeth yet. And then they can go and do that. And then have them make like a tick mark next to it or some way to complete it, so that there's some engagement there as well.
I mean, I manage my own life and my own responsibilities with checklists. So it makes
Right?
perfect sense that that would also help your child with ADHD get the things
Yes,
done that they need to get done.
exactly.
Okay, so we briefly we talked about this how, a third of the people with ADHD, they can really be helped with medication. Tell me a little bit about knowing when that might apply to your child.
Certainly. So parents are definitely the best to kind of know what that threshold looks like. And that's going to look different for different kids and different families and what works for them. But the way that we look at it here, so if you think again, their capabilities are here, their performance is here, that space in between, when that starts to really affect their success in school, their success with their peers, their self-esteem, that's the crux of looking at trying a medication. Again, the medication's goal is to bridge that gap so that they can reach their potential, the capability that they actually have.
Okay. Well, I know that there are lots of different options and as far as supporting your child with ADHD. And I know that this is just the tip of the iceberg on different ways that you can get the help that your kiddo needs for it. So thank you, Dr. Ewest, for your time today. I appreciate it. I know that lots of parents have some of these same questions too. So thank you.
You're welcome. Thank you.
Thank you.